Great. Okay, so doctor, what we're going to be doing is we're going to do a few interview scripts.
Sure.
We're going to use your phone.
Okay.
And we're going to set your phone up. So the first thing I want you to do is go into airplane mode. For you, swipe down.
I'm already in.
You're already in.
Yeah.
Fantastic. Okay, good. The next thing we're going to do is we're going to plug in this handy microphone kit,
Sure.
right, with the wireless.
Yep.
To get the best connection, what we like to do is take the case of your phone off.
Okay.
Sometimes the little connector doesn't actually reach in well. Good.
Okay.
So we're going to put this connector in. Goes right into the bottom.
Mm-hmm.
Okay, if you would mind opening your phone.
Mm-hmm.
Good. Good. And then I'm going to take a microphone here.
Okay.
I'm going to put this right here. We want the microphone roughly 6 inches. Oh, sorry. Roughly 6 inches from your lips, 8 inches, something like that.
That's right.
I'd like you to bring your hair over that if possible.
Yeah.
Good, just like that. Okay. I'm going to put this on just as the interviewer.
Mm-hmm.
Not really necessary, but I'm going to do it.
Okay.
Because what I'm asking you isn't going to be eventually on the final cut.
Sure.
It's just going to be your answers.
Okay.
So we're going to set the phone up on the tripod.
Okay.
I'm going to have you stand away from the wall, about 3 to 4 feet away from the wall.
Okay.
And you're going to be facing me exactly.
Oh, okay.
I'm going to be checking the lighting just to make sure the lighting looks good. Mm-hmm. And what I'm going to do right now, I'm going to go into video.
Okay.
And I'm going to do cinematic mode. Cinematic blurs the background. You've got that on your phone. I'm going to put you right in the center. Good. And the first thing we're going to do is we're going to test the audio.
Sure.
So go ahead and state your name and the name of your practice.
Okay. My name is Dr. Harpinder Shevchenko, and my practice is Smiles by the Sea Family Dentistry.
Fantastic. Go ahead and state your name and the name of your practice.
Okay. My name is Dr. Harpinder Shevchenko, and my practice is Smiles by the Sea Family Dentistry.
Fantastic. Perfect.
Yep.
Now, from a lighting perspective, that light is coming down and it's casting interesting shadows. So we're going to back up about 2 feet. Beautiful. Just like that. I'm going to come forward. Now, I'm going to be asking questions.
Sure.
When you talk, I want you to look, I'm kind of tall. I'm going to kind of try and squat down.
Okay.
You're welcome to talk to me, but otherwise you're going to be looking over the camera. It's going to look a little funny.
Yes.
So try it as much as you can, talk into the camera. I'm going to ask these questions.
Okay.
And what I want you to do is I want you to first pretend I'm a patient.
Okay.
This is what you would say to any patient.
Sure.
And I want you to be very expansive in your answer. We're not trying to go for brevity, short things. We're actually really trying to be explanatory to that individual because we're looking for a bunch of words here.
Sure. Got
Okay?
it. Yep.
I'm also going to ask the question, and what I want you to do, I want you to incorporate the question in your answer.
Got it.
So if I say, what is your name?
I'm going to say my name is.
Instead of just Harpinder. Okay,
Yeah.
you got it. Great. Good. So here we go.
Okay.
Doctor, what should I consider when choosing a dentist?
What one should consider when choosing a dentist is obviously a lot of people nowadays, is this so close to my house where I can go for my appointments very easily? Is this doctor if you're looking for a doctor who is you're planning to bring your whole family, then you're looking is the doctor a family doctor? And also, what kind of services you are looking for, do they provide those services?
Beautiful. Now, before I acknowledged you, I gave you a little bit of space so the editor can cut.
Yes.
And that's why a little bit of a delay. So if I don't acknowledge you right away, that's why we're going to let the editor cut.
Yeah, that's fine.
Good. Doctor, how do I find an expert in cosmetic dentistry in your city?
So in my city, to find an expert in cosmetic dentistry, I would recommend, look up the dentist's name, do a Google search, look, you're going to find their website, you can go through their reviews, look on their website, like what kind of services are they offering? Do they have something exactly you're looking for? Like, for example, if you're looking for like I1 veneers, so see if they have any services listed on their website. Do they have any patient photos? Normally the doctors would have photos on their gallery, like a photo gallery on their website. They may also have photos on their Google My Business page. So when you look up and you Google that, you might be seeing that. So those are some of the areas. And also one other area could be you may be able to find like a YouTube channel where they have videos or video testimonials from patients. So those are some of the areas where you can look for that.
Perfect. Good. In this next one, I want you to mention your city because we want to rank for your city.
Okay.
So your city would be?
Hampton.
Hampton.
Yeah.
Good. So, doctor, next question. How do I find an expert in restorative dentistry in Hampton?
So to find an expert in restorative dentistry in Hampton, you want to look up the restorative dentist, put in the Google search, restorative dentist in Hampton, New Hampshire. And you might see a list of doctors, or maybe there's only one doctor that you might see. So, mostly you will see their website. You might also see their Google page. So go into their website, look at that. Again, look into the categories. Okay, this is what I'm looking for. I'm looking for a crown. I'm looking for a composite filling, tooth bonding. So go into that, search those areas, look up, read about them. And also you can look at their Google My Business page as well too. Look for some photos, look for maybe their YouTube channel. There could be various channels that you might be able to see. Do your research and see if you like them and give them a call.
Beautiful. Doctor, what's the best way to schedule an appointment if I'm looking for a dentist near me?
So the best way to schedule an appointment if you're looking for a dentist near me, find that out, look, research for a dentist near me. And, if you're looking at their reviews and you see like, this is the doctor that I'm going to go to, there could be various ways. You can call the office or go to their website. A lot of doctors, they have a make an appointment button on their appointment as well, on their website as well. So you can, if it's a weekend, they're not open, you can just go to that, click the appointment button and just fill in your information, and somebody from the office will get back to you as soon as they're back in the office, or sometimes they have a services where they can get back to you right away. So those could be some of the ways where you can request an appointment.
Perfect. Good. Now we're gonna add on to this video a little bit because I want to ask more questions around these questions.
Okay.
Okay. So, doctor, can you please explain what a restorative dentist is and what restorative dentistry is, and is that different than regular old plain Jane dentistry?
Okay. So what a restorative dentist is, or restorative dentistry is, compared to the old general, old school dentistry, is where, you're restoring teeth. Means like if somebody has a broken down tooth, you're bringing that tooth to your original shape and form, very similar to that. So a person could have a broken tooth where they might do something called a crown, where they might cover up the whole tooth to restore that tooth to where it was originally at one point in time before it broke down. It also could be a bonding, which is also like composite filling or a bonding, which could be done as well to restore the shape and form of that tooth. Or, so those are main categories of being a restorative dentist or restorative work. And, many of them, they also fall into a category of general dentistry as well too.
Fantastic. Doctor, so talking about your practice, what are the things that you do? Is it restorative dentistry only or other services?
So we are full service dentistry. We do restorative dentistry, cosmetic dentistry, implants, periodontal procedures, whitening, pretty much everything.
Great. Let's talk about what each one of those things are and maybe define that to me as somebody. I don't know the differences between some of those things.
So restorative dentistry is that, we are restoring the person's original, similar to the original form and shape of the teeth. So it could be done by doing crowns, by doing veneers. It may also involve that if somebody has lost the tooth entirely, by doing an implant and then putting a crown on the implant so the person sees a tooth in their mouth. And regarding the cosmetic dentistry, if somebody doesn't like the shape of their teeth, they don't like the color of their teeth, so they have options as well. They could be, candidates for doing a crowns, which covers the whole tooth structure, whole the entire tooth, or they could be candidates for veneers, which like a little shells, mostly in the front of the teeth. And then they also could be, you could do a makeover with the implants, even also with the veneers. And one other thing I would mention is that we can also restore by doing the ortho, which is also called like, realigning your teeth, which could be with old school metal braces or with clear liners, different kinds of clear liners.
Great. And that's restorative.
Yes.
Great. Let's talk about the other categories you talked to me about, which the next one was cosmetic. What is cosmetic dentistry?
So cosmetic dentistry is when you're basically, you're looking to improve or enhance your smile and your look. So with cosmetic dentistry, it could be somebody might be a candidate for doing crowns, and then you could just brighten up and reshape their teeth and make them look nice and prettier. Or it could be done by doing veneers. So those are the main categories: veneers, or by doing crowns, you're changing the aesthetics and making it more prettier, and cosmetic dentistry comes into that category.
Great. Now look at what I'm doing while we're doing this. Am I engaging you verbally while you're answering these questions? Am I engaging you? Am I talking while you're talking or interrupting you?
No.
And what am I doing?
Just standing and probably acknowledging and giving.
Yeah, and I'm acknowledging by nodding, encouraging, and stuff like that. So it's very important that when you go back and you're doing this in your practice, the person here might even be so fascinated and be like, oh, great.
Yeah.
We don't want that in interrupting that answer. So just so you know, you're doing great.
Oh, thank you.
As usual. Now, you have this ability to look into the camera.
Yeah.
Some people don't. In the case that somebody doesn't, we take the phone and we put it right next to my face.
I see.
Might be your hygienist that we want to interview.
Yeah.
Which case you or someone else is talking with them.
Yeah.
And they're looking a bit sideways. So it kind of looks like this.
Yes.
And it's very standard and very acceptable.
Okay, great.
You have the skill to look into the camera, so
you.
we're gonna roll with that.
Okay.
Good. Next one. Well, we talked about restorative, cosmetic. Maybe define some of the other categories of the dentistry you offer.
Sure. So other, besides the restorative dentistry and cosmetic dentistry, we do also offer orthodontics, which is realigning your teeth. So in our practice, we offer it through clear aligners. The difference between the metal braces and the clear aligners is that clear liners are almost virtually invisible, and especially when you're, working age and even teenagers now too, it's just so much more easier for you to take care of those. So a lot of patients actually like that option, that they're able to take those aligners out, they're able to clean their teeth, they're able to do floss, they're able to maintain their hygiene much better compared to the oral metal school braces. So it's a great way of realigning your teeth, and typically the treatment times are shorter as well too. So we do offer orthodontic dentistry as well too in our practice.
Excellent. Good. Maybe define some of the other categories of dentistry that you deliver in your practice. We've covered general dentistry, cosmetic dentistry, orthodontics, and what else?
So besides restorative, cosmetic, orthodontics, we also offer implant dentistry as well too, which means is like if somebody has lost their tooth, to bring that tooth back, so they don't have to have something which is they have to take in and out of their mouth. They want this tooth which is fixed in their jaw basically. So we offer that kind of service as well too, where implant consists of 3 parts. So the first part is it takes place of the root of your tooth, where the root originally was in your bone. Little titanium post goes in your bone, and that gives us an anchorage basically, and then we put a crown which patient you will see that in your mouth. So it consists of 3 parts. The post goes in the bone, then there's a connecting piece, and then crown goes on top. So that could be individual single tooth crown, it could be multiple teeth, it could be a whole mouth, could be fitted with the implant. So we do offer those services as well in our practice.
So natural, so awesome.
Thank you.
Now, what we have just done, and I want to go over this with you.
Yeah.
I'm just going to make a comment here for those who are watching this. So you're just talking your thoughts on the subject as if you're talking to a patient or somebody's at a party and they're like, I haven't been to a dentist for a while, and they're asking that question very interestedly. You're putting your effort and your time into it. And in addition to that, nobody could ever, I could ask 5 dentists these questions, and those answers would all be slightly different. It'd basically be the same, but slightly different. Probably in the time that we've done this, you've probably pumped out about 2,000 words.
Oh, wow. Okay.
So I got a couple more questions for you, but
Sure.
the point of this is now we're going to take this, we're going to turn this into an article
Okay.
as well as a video. And that's going to, all the things that you're mentioning, these are all the questions people are searching on Google the most.
Sure.
So now you're going to start ranking for these things because you're talking about these things. Does that make sense?
Yes, that's great. Yeah.
Good. Got a couple more for you.
Awesome.
To wrap up this last video,
Sure.
we're going to put a call to action phrase in there
Okay.
that we're going to put at the end of the video.
Okay.
I'm going to read a sample to you.
Yeah.
And you're going to do your version of it.
Okay.
Whatever. You just do you, okay?
Sure.
So here's a sample.
Okay.
I hope we've been able to answer some of your questions on finding a dentist.
Mm-hmm.
But if you have any additional questions or if you're ready to take actions, please give us a call at our number.
Okay.
We're here to help.
Okay.
Something along that line. So
Sure.
I'd like you to just read that.
Okay. Yeah.
Good. And I want you to do your version of it right
Okay.
into the camera.
Okay. So I hope we have been able to answer most of your questions or all of your questions. And if you have any questions or you're ready to take an action, give us a call. Our office number is 603-926-8827. And we are here to help you get that healthy and beautiful smile.
Beautiful. Good. Everything's perfect about this. Here's what I want you to focus on this next one.
Okay.
Your speaking skill is great.
Yeah.
Your volume is great.
Okay.
You're looking into the camera.
Yeah.
Great.
Yeah.
One thing that happens when you're filming,
Yeah.
you're going from 3 dimensions
Yeah.
to 2 dimensions
Yeah.
of video,
Yeah.
is it mutes emotion. It actually takes a little bit off the top of emotion.
Oh, okay.
So I can't say that it takes it down a half a tone,
Yeah.
but what you and I would perceive here, you're in strong interest.
Yeah.
What it's going to appear here, it might even be like conservative to bored.
Oh, okay.
So I want you to juice
Like
it up
what?
a little bit.
Sure.
You
sure.
can use your hands. You can be animated.
Oh, okay. Okay.
Okay.
Awesome.
So let's try that on this next
Okay.
one. Ready? Doctor, why would a dentist recommend dental fillings?
So a dentist would recommend dental fillings is in different kind of scenarios. So one could be that if somebody has a cavity on the tooth, which that is one of the very most common reasons to recommend a filling. Other times is that if somebody has lost a tooth structure, so it kind of falls into a category of bonding as well too. So a filling or a bonding can restore part of the tooth structure as well too.
Awesome. Next question, I want you to even jump it up a little bit more.
Oh, okay.
Okay? Just have fun with it.
Okay.
Good. Good. Doctor, are there alternatives to getting a tooth filling?
Yes, there are alternatives to getting a tooth filling. So the alternative could be a veneer on a tooth. It could be a crown on a tooth.
Tell me more about that.
So the veneer could be an alternative to a filling. For example, if somebody has, chip on the tooth and it's a front tooth and it's not enough for the filling to be there, or the dentist can do a filling, but it's still not going to look that good. So you may have a concern cosmetically, you may not like it after. So in that case, it would be better in this situation to do a veneer so the tooth could look much better and your smile is so much more even and better as well. And other cases on the back molar teeth, it could be that the large filling may not be as stable. You can do that, but in few days, few months down the road, you may break it. So to have a better stability and a better option for you could be crowning the whole tooth. It's like 360, almost putting a helmet on your tooth, making it a lot more stable.
Beautiful. Good. Next one.
Okay.
I want you to smile.
Okay.
A lot on this one. Ready?
Okay.
Okay, here we go.
Okay.
Doctor, what are the pros and cons of different filling materials?
So the pros and cons of different filling materials, basically we have two main ones, is the old school silver fillings compared to the newer composite resin composite fillings. So the old school metal fillings, very, very first thing and the biggest reason is that they need a lot more cutting of your tooth structure, removal of the tooth structure. And versus with the composite fillings, they are a lot more conservative fillings, so we don't need to take a lot of tooth structure, so they can be done very minimally. And other thing is the color. So silver fillings looking silver, they are not aesthetic, so a lot of patients don't like it. So with the composite fillings are tooth color fillings, so no one even knows that you have a filling on the tooth. The other third difference is that over time, silver can create cracks in your tooth because it's a metal, it doesn't change. I mean, the tooth structure doesn't change around, but the metal contracts and expands with the heat in our mouth. So that creates crack lines on the tooth, and eventually the tooth ends up breaking. Versus with the composite, we are bonding in, it actually restores the tooth structure and keeps it together.
Beautiful. Good. Next question. Doctor, what is the procedure for getting a tooth filling?
So the procedure for getting a tooth filling is the very first thing is that you come in and most of the time the dentist will give you some numbing so you're comfortable, and we will, if there's a cavity in the tooth, that would be taken out, make sure tooth is all clean and it's safe to put the filling in. And then we isolate the tooth, meaning that with the newer composite materials, we want to make sure that your tooth is nice and dry, we don't have much saliva around, for the better longevity of that filling. So we, typically, the dentist might use like a rubber dam, or, we might put some cotton rolls around. So making sure your tooth is nice and dry, and then it almost like put a blue gel on the tooth, and we rinse it out, dry the tooth, then put a little another paint. And, you might see a blue light coming in. That light basically hardens or sets in that material in there. And then we put another layer of like a gel kind of a material. It's a thinner composite material, make the base with that, put a blue light again, and then put the more thicker composite material, put the blue light again. And then the dentist, we check the bite, then making sure that, it's all nice and smooth, you're not feeling anything, and off you go.
Amazing. Doctor, how are cavity fillings done between teeth?
So the way the cavity fillings are done between teeth is that we use something called matrices. So they are different for the front teeth and the back teeth. On the front teeth, you might see it's like a clear plastic film that the dentist will put in between the teeth. They will secure that with a little plastic, we call it a wedge, little plastic piece, and then follows the same procedure with the regular filling, doing the blue, we call it etch, and then you go through all these steps of putting the filling in. And for the back teeth, they are little small metal, we call them matrices again, little small metal matrices that go between the teeth, and the wedge goes in, and we're just basically creating the wall that you have lost. That matrix act as a, like you're baking some pan, like muffins, have a pan, so you put the your dough in there. So similar scenario, we make the wall and we pack in the composite there, and it gives us that structure, the form basically.
Awesome. Awesome. Even I'm learning things here.
Okay.
Good. All right.
It's hard. Like, how much do you explain?
No, but this is great. And this is so important. And this is a point I want to go over is when you're doing these explanations, just so you know, so many people have these questions. These are the most searched questions.
Wow.
The detail you're going into is exactly what we're looking for.
Okay, great.
Exactly what we're looking for. A lot of people say, well, basically you do this, we do it, and 25 words later, but it doesn't give the picture. And the way you're doing it shows competency, shows professionalism, but you're also not saying it in a condescending fashion. You're saying it in an educational fashion. So I'm learning who you are. You're educational. You're not going to embarrass me. I'll be able to ask you questions. And so I'm getting to meet you virtually through video.
Yes.
Very, very important. I want you to think just like you're doing. You're mentioning the name of something and then you're defining it. You couldn't do that too much or too often. Continue to just, you've been doing great. But every word that might be even like a crown, like you did, a crown, it's like a helmet for the tooth. That kind of explanation is very, very important.
Okay, great.
Good. Next question. Doctor, is the dental filling procedure painful? And if so, how do you mitigate the pain?
So dental filling procedure is not painful. And the way we mitigate that is that we make sure that you're very well anesthetized, means you're numb. So that way your nerve is taken care of. It's put to sleep, we call it. So it's, you're not going to feel anything. We take out the cavity, your tooth is pretty much sleeping and it's not going to feel anything, and you should not have any pain.
Beautiful. Now I want you to talk about what you do to mitigate the pain
Okay.
as compared to maybe what others might have experienced in the past, even 30 years ago.
Okay.
Sometimes you use different needles,
Yeah,
you warm
yeah,
up this, and that, hey, if there's ever a problem during the procedure where
yeah.
you do feel sensitivity, at our
Yeah.
practice, I don't know what you do, but most people say you lift
Yeah,
your hand and we
yeah.
all step back
Yeah, yeah,
and then you tell us what's going
yeah,
on, etc. So
yeah.
let's talk about that.
Okay. So to mitigate your dental pain while doing a dental filling, so I will make sure that you're fully numb before I even start the procedure. So I will ask my patients certain indicators. If we're doing a filling on the bottom tooth, I will ask the patient that, okay, is your tongue, that side of the tongue is feeling numb? If you're working on your left side of the tongue will be numb. If you're working on the right side, that will be numb. Is that part of your lip is numb? Another very good technique that I have learned from some great mentors that I use, it's been very successful for me, that even time patients tell me that, I went to other dentists and, I fell through the procedure. They gave me a lot of numbing, but I still wasn't numb. So there's something very special that I use. It's a small needle. I know everybody's afraid of needles, but I use a very small one. So don't be scared of that. And it's a special kind of syringe that I use. So I'm just numbing that particular tooth. So that way it's not the whole side of the mouth is numb, but also I'm taking care of that particular tooth where somebody may have a problem. And also I make sure that when you're sitting in the chair and once we start the procedure, I want to make sure that you're able to tell me if you're feeling something. You're able to raise your left hand up and give us an indication that you're feeling pain. You need to swallow, you need to close, you need to take a deep breath. We all will stop right away and give you that time. So I, like all my patients, I tell them in the beginning that we are in control. We are able to stop anytime you need to. All you need to do is just give us an indication and make sure that I want to make sure that you have no pain when I am doing any procedure on you.
Beautiful. Doctor, can you request dental sedation while you get a filling?
You can request a dental sedation when you're getting a filling done. Sedation could be different types. Sometimes patients, may ask their primary care doctor and they might take a little relaxing pill before they come into the office. Other times there are different other kinds of sedation that are present, is that giving you a laughing gas, that you could use that while you're getting a filling done.
Very good. Doctor, do fillings permanently fix cavities?
Fillings fix the cavity which was present at that time of the two when we started the procedure. But I always tell patients that you have to take care of the tooth because the cavity can still form around the filling. Filling material is not going to get a cavity, but your tooth can get a cavity.
Excellent. Doctor, do fillings have side effects?
So fillings typically do not have any side effects. One thing that patients may feel at times is some temporary cold sensitivity for a week or 10 days, but that is transient and it goes away a lot of times, most of the times on its own. And after that, patients feel perfectly fine.
Great. Maybe talk about when it doesn't go, what are some of the things you might do,
Okay.
and other cases that
Okay.
are, in rare cases, etc.
Okay. If you have a prolonged sensitivity which stays on for 2 weeks, 3 weeks, you always want to make sure you let us know that this is what's going on. Give us a call. We want to bring you back in. Maybe take an X-ray of the tooth, take a look clinically at the tooth with my eyes and see, make sure that the filling that we put in is all contained, it's well sealed. So we start from there. If the filling is well sealed, the second step could be we will check how you're biting on the tooth. Sometimes when you're numb, you're not able to tell how you are biting properly or not. So if you have a heavy bite on the tooth, that can irritate the tooth. And in that case, we try to take off, polish that tooth off. And a lot of times that sensitivity does go away with that. And in some rare occasions, if it lingers on for too long, and that typically happens when the cavity was too deep and your nerve just didn't like any material going close to your nerve. And in that case, you might end up needing treatment, which is called a root canal treatment, where the nerve may need to be treated.
Amazing. Doctor, will dental fillings match my tooth color?
So dental fillings do match your tooth color. So that is another, pro about the dental fillings, which we do these days, that we are able to match the color of your teeth. And a lot of times, a lot of patients have front teeth fillings and they are even second half doesn't even know about them.
Excellent. Doctor, what aftercare advice should I know if I'm getting a tooth filling?
So aftercare advice after getting a tooth filling is that very first thing and very important thing is that if you are numb, you want to make sure that you're not eating anything until your numbness is completely gone, because a lot of times patients end up biting their cheek, biting their tongue, and that creates an unnecessary complication and unnecessary botheration for the patient and discomfort. So very important that you don't eat anything until your numbness is gone away, and avoid anything too hot, too cold for the next 48 hours. Make sure everything settles well in the mouth. So those two are the main things that I always advise patients to watch for after they are getting the fillings done.
Fantastic. Doctor, last question.
Sure.
When should I schedule a dental appointment if I think I might need a filling?
So if you think that you need a filling, the time to schedule an appointment is right there and then. You immediately want to call your dentist and make sure you get an appointment, get seen right away, get checked out, and make sure that it's not beyond the filling or whatever your dentist tells you. Follow that and get that tooth taken care of.
Fantastic. Doctor, we're going to do the last thing, which is the call to action.
Okay.
I hope we've been able to answer some of your questions on dental fillings. But if you have additional questions or if you're ready to take action, please give us a call at your phone number. We're here to help. Something similar to that, naturally, you saying it, however you want to say it, into the camera.
Okay. I hope we've been able to answer some of your questions. If you have any additional questions or you would like to take the action now, our office number is 603-926-8827. You can call our office now to make an appointment, and I look forward to seeing you guys. I forgot what I was supposed to say there.
That was perfect. High five. Good. So now a couple things. First, it was fantastic.
Okay, very good.
And I want you to work on, just like you've done here.
Yeah.
So you look into the camera.
Yeah.
And you're talking shop and business, and that's okay.
Yeah.
When we press stop, all smiles and fun and bubbly. And I want you to bring a little bit more fun and bubbly into your future videos, because that's a part of you, I know.
Yeah.
And we all know, and your patients know.
Yeah.
And it's kind of a serious subject, dentistry. People don't like that. So it's totally acceptable to be fun and bubbly.
Sure.
You did a great job. My guess is on this last one, we probably got about 3,000 words.
Oh, wow.
That's massive. That's massive. And that's going to help you rank.
Okay.
We just completed 2 pages.
Wow.
And we're just going to keep you going when you go back.
Sure.
Yeah.
Sounds like a plan.
Great.
All right. Thank you so much.
Yeah.
Thank you, Austin.